In the last section, we talked about the hip adductors. Now we're going to talk about the abductors and the lateral rotators. The abductors, of course, are going to bring the thighs laterally away from the midline of the body. So when you're doing jumping jacks, you're going to be working these muscles. And the first is this tiny little muscle here called the tensor fasciae lati. I don't know how to pronounce it correctly. And it goes from the anterior superior iliac spine and the iliac crest and inserts on this wide tendon ligament that goes down this lateral side of the thigh. This is called the iliotibial tract or the iliotibial band. You may have heard of the IT band. That's what this is. And it connects the ilium and the lateral side of the tibia, hence IT band. So the tensor fasciae lati is going to pull the lateral side of the thigh up and out sideways, abducting the thigh. This is also going to help medially rotate the thigh by pulling the front of the thigh toward the center. Okay, so that's that one. And this is the IT band. The IT band on some people can get tight and cause pain. And because it is connective tissue, it's just dense, regular connective tissue. What needs to be stretched isn't so much the IT band itself, although it does need to be stretched. It's the muscles in around it and attached to it that also need to be stretched. So, and this can be kind of hard to stretch, like your lateral thigh, it's a little hard to do, okay? But this is something that if it does become too tense, you can get knee pain. Now, the gluteus maximus is this one here, which is going to be your primary hip extensor. Okay, it's going to pull the leg back. And the gluteus maximus has a big origin from the back of the iliac crest all the way down the sacrum to the coccyx. And then it inserts on both the linea aspera on the back of the femur and the gluteal tuberosity, but also on the IT band, this iliotibial tract. So that's why it has this complex movement of both extending the thigh and laterally rotating the thigh. The other abductor is the gluteus medius, which is this one here. Okay, so the maximus is the biggest one. The medius is medium-sized and does imply the presence of a minimus, and there is a gluteus minimus, which we're going to come to in a minute. So this one is primarily a thigh abductor. It's going to pull the thigh with the tensor fasciae latae, laterally abducting the thigh. It also has this weird thing that when the thigh is straight or extended, it helps to laterally rotate the thigh, but when the thigh is flexed, it medially rotates the thigh. And this somehow makes sense, but I have a hard time wrapping my brain around that one, which means it's unlikely to come up on a test. Make sure that you know this, though, that it is the thigh abductor. Now, this is what it looks like on a cadaver, and you can see that it goes from the greater trochanter to just below the iliac crest. And so here it is on this GIF. You can see that extension, okay? And that's important because it covers up the gluteus minimus, okay? Just like the pectoralis major completely covers the pectoralis minor, the gluteus medius completely covers the gluteus minimus, okay? So you can only see the gluteus minimus if you cut away the gluteus medius, which is what's been done here in this diagram. So here's the gluteus maximus that's been cut and pulled away. Here's the gluteus medius that's been cut and pulled away so that we can see the gluteus minimus under it, okay? It is a synergist to thigh abduction, and it's going to have the same motion as the gluteus medius, the same, sometimes laterally rotating, sometimes medially rotating. On the cadaver and on this diagram, you can see that it's a much smaller muscle, and its origin is much more inferior on the ilium. So here's the two of those together. Okay, so you can see If the muscle is all the way up here on the ilium, then it's the medius. If the origin is farther down, then it's the minimus. Okay, so that's how you're going to distinguish those two. All right, the next group of muscles are these small muscles here that are the lateral rotators. So these work to turn the thigh laterally, turn the femur laterally. From the top, they are the piriformis, the superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. The piriformis you may have heard of because this muscle can cause pain in the sciatic nerve. The sciatic nerve is supposed to exit between the piriformis and the superior gemellus. But if this muscle becomes overcontracted, becomes shortened, it can put pressure on the sciatic nerve and cause pain on the sciatic nerve. But in something like 20% of people, the sciatic nerve actually exits in the middle of the piriformis. And so if that piriformis is tight, it's pinching on that sciatic nerve all the time. So that can cause a lot of pain. The way that you stretch this piriformis is that you use your sartorius muscle of one leg to cross the foot over the opposite knee, and then use your hip flexors to bend your torso forward. Okay, and you can either do this sitting in a chair, cross one leg over the other and sit forward, or you can do this lying down and pull your knees up toward your chest with one foot over the other knee. And that is going to get to these little lateral rotators, especially this piriformis, kind of open up those hips. Okay, so that's the piriformis. And then we have the superior gemellus and the inferior gemellus with the obturator internus between them. Gemellus, for anyone who speaks Spanish, you recognize this root. It comes from the same root as gemela, meaning twins. So we have the twins, the superior and inferior, and then between them, the obturator internus, which originates on the obturator foramen. I know who to thunk. These all insert on the back of the femur, so they're going to bring the back of the femur toward the back of the os coxae. And then this quadratus femoris is a nice rectangular muscle, hence the name quadratus. Okay, so there is a mnemonic to help remember these, and it includes the gluteus minimus, okay? And it's God, please save our idiot queen. So gluteus minimus, it's God. Piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. All right, so that is your lateral rotators and thigh extenders. So here's our gluteus maximus, primary thigh extender and lateral rotator. Partly covered by that is the gluteus medius. All right, this part right here is the gluteus medius. This is the tensor fascia lati, and this is the IT band, or IT tract, iliotibial tract, okay? And then on this model, this is one of our torso models that we have in the classroom, and this is the only one we have that shows the gluteus minimus. So here is the gluteus maximus cutaway, here's the medius cutaway. So here we have the gluteus minimus here, and then we have piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris, okay? So those are all of those on our models. And up next, we're going to talk about the hamstrings and the quadriceps muscles.